Welcome to Integrative Medicine Perspective. I'm Dr. Wenli Liu. Well wish for lush, healthy hair. If we search online for hair and nails, we'll find numerous supplements claiming to enhance hair quality. They often contain biotin, vitamin C, vitamin E, and cysteine. But do these supplements actually benefit our hair? Presently, there's no strong evidence supporting such a claim. These supplements often contain very high doses of biotin, often thousands of times the recommended intake. The long-term safety and benefits of consuming high doses of biotin remain uncertain, but at least we know high-dose biotin supplementation can affect the accuracy of certain clinical lab tests like thyroid function, vitamin D level, and cardiac enzyme test, presenting obstacles for accurate clinical diagnosis and treatment monitoring. Without reliable tests, wrong diagnosis and inappropriate treatment adjustment can happen. So we must be cautious about potential harms of high-dose biotin supplementation. The quality and quantity of our hair can be affected by many factors: genetic, age, hormone levels, acute and chronic illness, and the nutritional status. I will focus our discussion on the relationship between nutrition and hair health. Hair components include oils, proteins, water, and minerals. Proteins, especially keratin, can make up to 95% of the hair's weight. Since proteins are the biggest component of hair, so adequate protein intake is crucial for hair growth. Our bodies are very smart. When protein intake is inadequate, our bodies will not prioritize a head full of hair. They will prioritize more essential life functions over hair and nails. So adequate protein intake is vital for hair health. You may notice many of these hair and nail supplements contain ingredients like cysteine, an amino acid abundant in keratin, but keratin is made of 18 different amino acids. Relying solely on cysteine supplement is not sufficient for hair, especially since it's a non-essential amino acid, meaning our bodies can produce cysteine and are not entirely rely on its intake. Besides protein intake, other nutrients vital for hair health include vitamins and minerals. And biotin is such a nutrient. It is indispensable for fat and protein metabolism, like synthesizing keratin. So biotin deficiency can lead to hair and nail issues like thinning, brittleness, and breakage. However, biotin deficiency is very rare in the United States. When biotin is sufficient, excessive amount supplementation will unlikely benefit hair and nails, because biotin will not be the answer to hair loss of non-biotin related causes. On the other hand, excessive keratin synthesis can clog hair follicles, hindering normal hair growth. This can be seen in vitamin C deficiency. So vitamin C is also crucial for hair health. Additionally, many B vitamins, B2, B6, B12, folate, and niacin, along with fat-soluble vitamins A, E, and D, are all essential for hair health. Various minerals are equally essential for hair health. Magnesium, for instance, is involved in over 300 different enzymatic reactions, including protein and nucleic acid metabolism. Insufficient magnesium reserve can hinder hair growth. Another example, iron, is also vital for the health of hair follicles. Iron is an important component of hemoglobin, which is responsible for supplying oxygen to hair follicle cells. Iron deficiency, a common cause of anemia, can lead to hair loss. Besides being an important component of hemoglobin, iron is also required for nucleic acid synthesis, directly affecting follicle cell reproduction and growth. Other important minerals include zinc, copper, selenium, silicon, and calcium, also directly influence hair development and growth. Indirectly, all minerals essential to the body can affect hair growth. For instance, iodine is an important component of thyroid hormones, and thyroid dysfunction can significantly affect hair health. When discussing hair health, we have to talk about the two major nutrients, fats and carbohydrates. Sebaceous gland in hair follicles produce sebum protecting hair, but excessive sebum production can also damage hair follicle, leading to hair loss and regeneration issues. Fat intake, including saturated fatty acid, unsaturated fatty acid, and essential fatty acids, affects sebum secretion through their regulation of metabolism, hormone levels, and inflammation. Concerning carbohydrates, surplus of sugar in the body converts to triglyceride. Sebum comprises nearly half triglyceride. Excessive sugar intake increases sebum secretion. High sugar containing food can also damage hair through another mechanism. Excessive sugar intake increases blood sugar levels, slowing down capillary blood flow, affecting hair follicle blood supply. Hair loss is relatively common in diabetic patients, especially when microvascular complications, meaning diabetic heart, kidney, and eye diseases occur. Lastly, let's discuss the impact of phytochemicals, specifically flavonoids, on hair. Research suggests that fresh vegetables can help reduce male pattern baldness caused by androgens. Flavonoids have also been shown in animal studies to promote hair growth. The exact mechanism of how flavonoids benefit hair isn't fully understood, but some of their biological effects can help us understand their benefits. First, flavonoids regulate inflammation, metabolism, and platelet function, protecting blood vessels and microcirculation. Secondly, flavonoids protect the skin, of course, including scalp, against the damage by UV radiation. In essence, the health of hair requires a multitude of nutrients, not just a few vitamins and amino acids. Thinking deeper, the health of hair is not different from the health of other bodily organs. Hair follicle cells also acquire nutrients through the bloodstream for energy production, utilization, and synthesizing substances like nucleic acid, fats, and proteins. These biological processes rely on a wide array of nutrients that share commonalities across every living cell. So, specially formulated supplements targeting a specific organ lack theoretical basis. We should not be surprised that there is no strong evidence supporting such supplements. In a previous video, I discussed a salad beneficial for eye health. Now let's see if it also caters to the hair health needs. In the previous video, I already talked about the salad being rich in vitamin C, vitamin E, zinc, selenium, and copper. We can see eggs are rich in protein. Eggs are also very rich in biotin. One egg can supply 33% of the daily recommended biotin intake. This salad has 2 eggs, supplying 66% at least the daily recommended dose. Eggs are also rich in vitamin B12. Eggs, spinach, and hemp seeds are rich in iron. Spinach, whole wheat pasta, and hemp seeds are rich in magnesium. Overall, these foods offer significant amount of nutrients necessary for hair health, except vitamin D. Adequate vitamin D relies on appropriate sun exposure. When we analyze nutritional requirements of each organ, we realize that they far surpass what multivitamin supplement tailored to that specific organ or not can provide. At the end, I will leave a question. When we supply our bodies with high doses of biotin and cysteine for hair and nails, will our bodies only or primarily use them for that purpose, not other unwanted production? Thanks for watching. Please leave comments and questions. I will see you next time.